Meet Margaret, a vibrant 68-year-old woman who loves gardening, cycling, and dancing. But her hip pain became unbearable, affecting her mobility and quality of life. Margaret sought medical advice from an orthopedic surgeon renowned for his expertise in joint replacement surgery. He asked detailed questions about her pain and medical history. The surgeon assessed Margaret's range of motion, strength, and overall hip function. X-rays revealed advanced arthritis in her hip joint. The surgeon presented Margaret with treatment options, including total hip replacement surgery. Shared decision-making was emphasized to help her choose the best option for her quality of life. Margaret decided on total hip replacement surgery, which would provide pain relief and improved mobility. She would have to attend joint school before her operation and would have the chance to ask further questions. She wanted to regain her independence and return to her active lifestyle. Don't forget to subscribe and like.